Hey everyone, welcome back to the channel. Today we're talking about something really important, the warning signs of a stroke. A stroke isn't just life-threatening, it can also leave people with lifelong disability. But here's the good news, before a stroke happens, this sneaky condition almost always shows some signs. Besides the obvious symptoms like facial drooping or slurred speech, there's actually a hidden warning sign right here on your thumb that can help you assess your stroke risk. If you can recognize this signal, you might just have a chance to stop a stroke before it starts. If you have a family member with high blood pressure or any cardiovascular condition, I really want you to watch this whole video and honestly save it, bookmark it, share it, because knowing these signs could literally save a life. Before we get to that hidden sign on your thumb, we need to go over a few other warning signals that are just as important, but especially easy to overlook. These might seem like small, everyday things, but for people with high blood pressure, diabetes, or heart disease, these could be your brain sending out an SOS. Signal number one, uncontrollable hiccups. Hiccups, we've all had them. Eat too fast, you get hiccups. Drink something cold, you might get hiccups. Sometimes they just show up for no reason at all. A few hiccups here and there, they stop after a couple of minutes, that's all normal. But here's what you need to pay attention to. If you or a family member suddenly starts hiccuping continuously, like nonstop for hours, and it just won't quit, that is a red flag. This is not just, I had a big meal hiccups. This is something to take seriously. Why? Let me explain. Deep in your brain, there's something called the respiratory center. Think of it like a command center that controls your breathing and your diaphragm. That's the muscle between your chest and your belly. When your brain isn't getting enough blood, say because of narrowed arteries from things like atherosclerosis, that command center doesn't get enough fuel, it can start malfunctioning. It sends the wrong signals to your diaphragm, and suddenly you're hiccuping nonstop. Also, here's something many people don't know when a stroke is about to happen. Your body is under a lot of stress. That stress can sometimes cause damage to your stomach lining, even upper gastrointestinal bleeding. That blood irritates your stomach, which in turn irritates your diaphragm, and that can trigger persistent, stubborn hiccups. So please remember this. Occasional hiccups, no big deal, but persistent, stubborn hiccups that you can't explain, especially if you already have high blood pressure, high cholesterol, or diabetes, do not ignore it. This could be your brain struggling for oxygen. Signal number two, nonstop yawning. Yawning, we're all familiar with it. You're tired, you're in a stuffy room, you yawn to wake yourself up. It's a normal body response. But if you've been sleeping well, a full night's sleep, and you're not feeling particularly tired, yet you find yourself yawning uncontrollably one after another, like you just can't get enough air, that's not being tired. That's your brain starving for oxygen. Let me give you a way to picture this. Think of your blood vessels like the pipes in your home. Over time, plaque builds up, kind of like limescale inside a pipe, and the inside diameter gets narrower, blood flow slows down. Your brain is one of the most oxygen-hungry organs in your entire body. When blood flow decreases, your brain goes into a state of chronic lack of oxygen. Your body is smart. It tries to save itself. It makes you yawn to force a deep breath, pulling in more oxygen to temporarily relieve that oxygen hunger. Here's a number that might surprise you based on clinical observation. Up to 80% of stroke patients experience this kind of excessive yawning in the 5 to 10 days before their stroke. 80%. So if you or someone you love is yawning like they just can't get enough air despite being well rested, don't brush it off as just being tired. This is a signal worth paying attention to. Signal number three, brief trouble speaking or facial drooping. This one is more well known, but it's also one of the most dangerously dismissed. Picture this. You're talking with your family or watching television, and suddenly your tongue feels like it's not listening to you. The words are right there in your head, but when you try to say them, they come out slurred, or maybe you can't get them out at all. Sometimes you might notice one side of your mouth doesn't seem to move right. You try to smile and it feels stiff. And then here's the tricky part. Within a few minutes or even just seconds, it's gone. Everything goes back to normal. You feel fine. So many people think, that was weird, and then they move on with their day. They forget about it. That is extremely dangerous. In medicine, we call that a transient ischemic attack, or TIA. People also call it a mini stroke. Think of it like a dress rehearsal for the real thing. Here's what happens. A tiny clot briefly blocks a small blood vessel in your brain. The part of your brain that vessel supplies gets starved for oxygen, and you get those temporary symptoms. Then the little clot breaks up or it gets pushed along, blood flow returns, and the symptoms disappear. But here's what you need to understand. Even though the symptoms went away, the danger did not. The fact that it happened at all means there's already unstable plaque or clots in your system. The next one could block a bigger, more important artery and cause a full-blown, permanent, life-altering stroke. So please let me be very clear. Any sudden, unexplained trouble speaking, slurred speech, or facial drooping, even if it lasts only a moment and goes away completely, you need to take that seriously. This is not a wait and see situation. This is your brain giving you a direct warning. Signal number 4, temporary vision loss. Have you ever been standing or sitting, maybe going about your day, and suddenly everything goes dark in one eye, or your vision gets blurry, like you're looking through frosted glass, and then a minute or two later, it clears up like nothing ever happened? A lot of people assume it's anemia or low blood sugar, or maybe their eyes are just getting tired. Some might think it's just aging, but this can actually be a very early warning sign of a stroke. Here's why your eyes rely on a constant, steady supply of blood to see. The artery that feeds your retina, the light-sensitive tissue at the back of your eye, is actually a branch of your carotid artery. That's the main artery on either side of your neck that supplies blood to your brain. So when your carotid artery becomes narrowed from plaque, or when a small clot forms, blood flow to your eye drops temporarily. That gives you that brief blackout or blurriness. When the clot moves or blood flow returns, your vision comes back. This is called transient monocular blindness or a transient blackout. The key features: it comes on suddenly, it lasts a short time, and it goes away on its own. Because it happens fast and clears up fast, it's incredibly easy to dismiss, but it's revealing a serious problem. Your brain's blood supply system is already under stress. The alarm bells are ringing. Don't ignore them. The thumb sign, your body's final warning. All right, we've covered those 4 easy to miss signals. Now let's get to what I promised, the hidden warning sign right here on your thumb. There's an old saying, the fingers are connected to the heart. In traditional medicine, it's believed that our fingers are like windows into our internal health. Each finger connects to different organs and energy pathways. Every single finger is like a window into what's going on inside your body, and today the thumb is our focus. In traditional medicine, the thumb is connected to the lung and heart meridians. Why does that matter? Because the heart pumps your blood. It's the engine for your entire circulatory system. And the lungs manage oxygen and help circulate energy throughout your body. Together, your heart and lungs determine how well your brain gets the oxygen-rich blood it needs. So when your cardiovascular system starts to struggle, it can actually show up in your thumb. Here's what I want you to do right now. Hold up your thumb and look at the fleshy pad, the part you use for your fingerprint, the most plump part of the pad. In a healthy person, that pad should be plump, pink, and elastic with fine vertical lines. That's normal. The stroke warning sign is something different, deep, horizontal lines across that pad, not wrinkles from aging, not calluses from work. These are lines that appear over time, like a deep groove or crease running across the surface. It's as if a ditch suddenly appeared on flat ground. One or several of these lines. Clinically, doctors have observed that many patients who have already had a stroke have these horizontal lines on their thumb pad almost without exception. So if you have high blood pressure, high cholesterol, or any vascular condition, and you notice these lines appearing on your thumb pad, especially if they're new, that is a strong signal that blood and energy stagnation may have become serious. It's a sign that your stroke risk may be elevated. Now, let me be clear, we do not diagnose a stroke based on one sign alone, but if you have those horizontal lines and any of the other symptoms we talked about, like sudden trouble speaking, slurred speech, tongue deviation to one side, or numbness in your fingers, that combination is a powerful warning. Specifically, if you have the thumb lines plus any one of these three: language difficulty, like sudden slurred speech or trouble finding words; tongue deviation, where the tongue points to one side when you stick it out; or finger numbness, especially in the middle fingers without any known neck issue. If you have the thumb lines plus any one of these, do not wait, do not hesitate. Go to your doctor or the emergency room immediately. Get a brain CT and MRI. A carotid ultrasound, early intervention can stop a major stroke before it happens. What you can do at home: the thumb exercise. So what if you notice some of these signs, or what if you want to be proactive? Besides seeing your doctor, are there things you can do at home to support your vascular health? Absolutely. Your hands are sometimes called your second brain. Moving your fingers and stimulating your hands can directly activate the corresponding areas in your brain and help promote healthy circulation. Let me teach you a very simple but effective thumb exercise. Here's how you do it. Extend your hand. Take the pad of one thumb and gently rub it against the pad of your index or middle finger on the other hand. That's it, just a gentle rhythmic rubbing back and forth. You can do this while watching television, while waiting for your coffee at Starbucks, while walking around the house, or even sitting at your desk. Do about 80 rubs, that's one set. Aim for 3 sets a day. Of course, if you have time to do more, that's even better. Now, don't underestimate this simple movement in traditional medicine. The root cause of many cardiovascular issues is believed to be stagnation of energy and blood. This rubbing action stimulates the tiny nerves and capillaries at your fingertips, which helps promote blood flow and reduce stagnation. It can be a helpful supportive practice for preventing strokes related to poor circulation. But, and I need to emphasize this for anyone already diagnosed with heart disease, vascular disease, or who has already had a stroke, this exercise is a supplement to your treatment, not a replacement. Keep taking your medications exactly as your doctor prescribed. Do not use this exercise as a substitute for medical care. More at-home practices for vascular health. Beyond the thumb exercise, there are a few other simple things you can do at home to help reduce your stroke risk. Let me walk you through them. Number 1, scalp massage. The blood vessels in your scalp are long, narrow, and winding, which means they're prone to becoming blocked. So regularly massaging your scalp is very beneficial. You can do this yourself, or you can have a family member, your spouse, your kids, anyone help you use your fingertips, not your fingernails. Gently massage your entire scalp as if you're combing your hair, starting from your forehead and moving toward the back of your head. Do it evenly and gently until you feel a slight warmth. That warmth means increased blood flow. This helps support circulation in your head and can help reduce the risk of blockages. Number 2, neck care. On either side of your neck, you have 2 extremely important arteries called the carotid arteries. These are the main highways delivering blood to your brain. They're also a very common location for plaque buildup. So taking care of your neck is essential. When you've been watching television or looking at your phone for a while, make sure you move your neck. Do some slow turns, some gentle tilts, some chin tucks, some looking up. Just be careful. Don't do anything too fast or too aggressively. Another great practice: warm up your hands by rubbing them together, then use your palms to gently massage the sides of your neck. Move at a pace that feels comfortable and continue until you feel a little warmth or a slight redness in the skin. Doing this for a few minutes in the morning and a few minutes in the evening can help support blood flow and reduce the buildup of plaque in your carotid arteries. Number 3, shoulder stretches. There's a saying: the shoulders and neck are connected. When your shoulders are tight, it adds pressure to your neck, which can affect blood flow to your brain. So releasing your shoulders is really important. Here's a simple stretch I love. Clasp your hands behind your back, interlace your fingers, and gently pull your hands downward while lifting your chest up. Hold this position for a few seconds. You should feel a nice stretch across your chest, shoulders, and neck. Do this about 8 to 10 times a day. After you do it, you'll notice your whole upper body feels more open and relaxed. It's a great way to release tension that can interfere with healthy circulation. These small movements don't require any special equipment, no gym membership needed. You can do them at home, at work, anywhere. The key is consistency. Doing a little bit every day really adds up. Eating for vascular health: your stroke prevention grocery list. Now, let's talk about food. There's a saying 3 parts exercise, 7 parts diet. If you want healthy blood vessels, movement alone isn't enough. You also need to pay attention to what's on your plate. So, let me give you a list of foods that can help reduce your stroke risk. Take a look. Are any of these already in your kitchen? Even just having one of them regularly is a good start. One, bananas. Bananas are often called the happy fruit, and they're also great for your heart and brain. They're rich in potassium, which helps your body flush out excess sodium. That helps maintain healthy blood pressure. And stable blood pressure is one of the most important factors in preventing stroke and cardiovascular disease. Two, citrus fruits, oranges, grapefruits, lemons, limes. These are all citrus fruits. They contain flavonoids, specifically a type called flavonones. Some research has found that women who eat citrus fruits regularly may have a nearly 20% lower risk of ischemic stroke. Three, coffee. If you're a coffee drinker, here's some good news. Studies suggest that moderate coffee consumption, about 2 to 4 cups a day, may be linked to a lower risk of stroke, but balance is important. Once you go beyond about 6 cups a day, that benefit disappears and you may actually increase other health risks. So enjoy your coffee, but keep it moderate. Four, celery. Celery contains an important nutrient called folate. Folate helps your body break down a substance called homocysteine, which can damage your blood vessels when levels get too high. So adding celery to your salads, soups, or even snacking on it with some peanut butter is a great choice for vascular health. Five, spinach. Spinach is another folate powerhouse. It's also rich in iron. Folate and iron work together to support healthy red blood cell production, which improves your blood's ability to carry oxygen. That means better oxygen delivery throughout your body, including your brain, helping blood flow more smoothly and reducing stroke risk. Six, grapefruit. Grapefruit is packed with nutrients. It's high in vitamin C, and compounds found in both the flesh and the peel may help lower blood lipids and reduce blood viscosity, which lowers the risk of clot formation. Just one note, if you're taking certain medications like some cholesterol lowering statins, check with your doctor before adding grapefruit because it can interact with them. Seven, olive oil. The oil you cook with matters. Olive oil, especially extra virgin olive oil, is rich in heart healthy unsaturated fats. Research has shown that people who use olive oil regularly have a significantly lower risk of stroke compared to those who don't. Eight, sweet potatoes. Sweet potatoes are a classic example of a high potassium, low sodium food. That potassium content is excellent for blood pressure management. Some studies suggest that eating potassium-rich foods like sweet potatoes can lower stroke risk by about 20%. Nine, chili peppers. This one might surprise you. In some regions where spicy food is common, think places where chili peppers are a daily part of the diet, stroke rates tend to be lower. Capsaicin, the compound that gives peppers their heat, may help blood vessels relax and improve circulation. Now, this doesn't mean you should start eating ultra spicy food if it bothers your stomach. Listen to your body. If you enjoy a little heat, go for it. If spicy food gives you heartburn or stomach issues, skip it. The goal is to support your health, not make yourself uncomfortable. Putting it all together, your complete summary. All right, we've covered a lot of ground. Let me bring it all together so you have a clear takeaway for you and your family. First, watch for the 5 critical warning signs. If you or a family member experience any of these symptoms, please seek medical attention immediately. These could be your brain sending its final warning thumb lines, deep horizontal lines appearing on your thumb pad. Especially if they're new, these can indicate significant blood and energy stagnation and are a strong signal of elevated stroke risk. Persistent hiccups, hiccups that last for hours or more without explanation, this can be a sign your brain's respiratory center isn't getting enough blood. Excessive yawning. Yawning uncontrollably even when you're well rested. This is a classic sign of brain oxygen deprivation, speech or facial issues, sudden trouble speaking, slurred words, tongue deviation to one side, or facial drooping, even if it lasts only a moment. This could be a mini stroke or TIA, vision blackouts, brief vision loss, or blurriness that comes and goes. This can indicate your carotid artery is struggling. If you have the thumb lines plus any one of the other symptoms, especially speech issues, tongue deviation, or finger numbness, do not wait. See a doctor immediately. Second, simple at-home practices to support circulation. Do these daily. They help stimulate your nervous system and promote healthy blood flow. Thumb rubbing, rub the pad of your thumb against your index or middle finger, about 80 rubs 3 times a day. This stimulates circulation at the nerve endings. Scalp massage, use your fingertips to massage your entire scalp from front to back until you feel warmth. This enhances blood flow to the head. Neck care, gently turn and stretch your neck and massage the sides of your neck with warm hands. This supports the carotid arteries. Shoulder stretch, clasp your hands behind your back, pull down and lift your chest. Do this 8 to 10 times a day. This relieves tension that can affect circulation to the brain. Third, eat to protect your blood vessels. Add these to your grocery list. They're some of the most cost-effective ways to support vascular health: high potassium foods, bananas, sweet potatoes, citrus fruits, oranges, grapefruit, lemons, coffee, 2 to 4 cups a day, moderate folate-rich vegetables, celery, spinach, healthy fats, olive oil, spicy options, chili peppers if tolerated. Fourth, 3 critical reminders to keep in mind: do not self-diagnose. These signs are warning lights. They tell you something might be wrong. They are not a diagnosis. If you notice them, see your doctor and get the appropriate tests: brain CT, MRI, or carotid ultrasound. Never stop your medications. If you have high blood pressure, high cholesterol, or any vascular condition, take your medications exactly as prescribed. Exercise and diet are powerful, but they are alongside your medical care, not a replacement. Stick to healthy habits, eat well, move your body, don't smoke, limit alcohol, and manage your stress. These are the foundation of long-term health for any chronic condition. Your health isn't just about you, it's a gift to the people who love you. It's one of the biggest sources of happiness for any family. If you found this video helpful, please give it a thumbs up and share it with someone you care about, especially any older friends or family members. You never know, your one share might be the reason someone catches a warning sign in time and prevents a tragedy. Drop a comment below if you've ever noticed any of these signs, or if you have questions. I read them, and I'm here to help you understand the science behind them. I'll see you in the next video. This is for educational purposes only. Always consult your own doctor before making changes. If you're dealing with any health concerns, please schedule a visit with your primary care doctor. I'm here to help you understand the science, not replace professional medical advice.